Good morning, everyone, and welcome to this heritage lecture. This is a series of lectures which has been initiated by the Office of the Director as part of our commemoration of two major events in the history of our institution. One is the centenary year of existence of this campus, and 125 years of the history of CMC. It's a very important series of lectures, and I'm actually a little disappointed to see so many empty seats here, and also a little disappointed that there are not many people here outside the ENT department. And the reason why this is important is, I'll just kind of allude to a short, history of in the Bible. When Moses led Israel out of Egypt, there are three times where he kept talking to them, but there are three kind of landmark discourses of his. One is when just before they came out of Egypt at the time of the Passover. And then the other one was when he actually gave them the law. And the third thing was just before he handed over to Joshua. And there was a lot of instruction which Moses gave the Israelites. And all three of these were punctuated with one particular instruction saying, don't forget to tell this to your children and your children's children and the generations that follow. And sadly, if you go to Judges chapter 2, verse 10, that is soon after the time of Joshua, it reads like this. And also all that generation were gathered unto their fathers, and there arose another generation after them, which knew not the Lord, nor the works which he had done for Israel. So this is something which is very scary, and it can very easily happen to us. And it is our responsibility as people who have gone through this to keep repeating this story of ours to generations that follow. And if we do not do this, what happened to Israel eventually is likely to happen to us. So with that, I'd like to encourage each one of you to not just stop with this heritage lecture, but please keep telling your juniors about how God has led your department and brought it thus far. We've got the Moseses of the generation like Ruby, and then you've got the Joshuas. So please carry it forward and don't have a situation where there arose a generation of ENT surgeons who knew not the history of what God did for them. So with that, I'll hand over to Ruby and to Suma, and who will moderate this session on the heritage of ENT.
Thank you, Dr. Ranjan. Good morning and a very warm welcome to today's heritage lecture, where the Department of ENT will share the rich heritage we have received from our predecessors. The year 2024 is a red letter year in the history of our institution. We are celebrating 100 years of functioning on this campus, 125 years of our existence. In the history of the Department of ENT too, it's a red letter year. It's 100 years since we've been functioning as a department, initially as the Department of ENT and I. Today, Dr. Ruby will walk us through our heritage from our beginnings till the year 2014. In 2014, we became 5 units, functioning as 5 units, practicing general ENT and a specialty too. So after Ruby's talk, we will hear from each of the 5 units, and they will share the period 2014 till date. Welcome, Dr. Ruby.
Good morning, and it is with pleasure that I stand here to honor all that has been handed down to us through the decades, and to respect and recognize all those who have done it. At the beginning, let me tell you that I've put in a sincere effort to capture as much history as possible and put it down. I do hope I've made I do some justice to it. And before I begin, I would also like to thank God for what we've been given and all those who have helped me put this down together. True to the spirit of CMC and its founder, our pioneers in ENT pitched in when and wherever the situation arose. Ida Scudder, it is told that Ida Scudder managed ENT and all its surgeries and even mastoidectomies in the early days. In 1924, Dr. Helen Gibson was in charge of the ear, nose, throat, and eye department in Mary Tabler Shell. And in 1928, is this a pointer? Dr. Pauline Jeffrey of anatomy was asked to take over the ENT services, which she did till 1936 when she fell ill and moved back to the US in 1937. Dr. Bernardine. How does it move? Oh, it's frozen. Yeah. Dr. Bernardine, who joined the institution in 1936, was then asked to head the department from 1937. But she had no ENT qualifications, and the medical students had to go to Madras for their postings as well as their exams. So during her furlough, she obtained the FRCS in ENT and returned back in 1946 when she was given an independent ENT department, which she ran in Thottapalayam. Dr. Bernardine, in her annual reports, says that she initially managed the department with 2 assistants, late Dr. H.S. Butt and Dr. David. She found it difficult to run the department after these 2 left. They had to move on. For periods of time, she had to manage the department with house surgeons, raw graduates who were posted there for 2 to 3 months. And again, in her reports, she says they rose to the situation, but it was not the best as they had to rotate. She married Mr. Devloy of MKBG Panay and moved residence there. She found it difficult to commute up and down, but she did so till 1951. And then she opted to do part-time work. In 1953, Dr. Devloy resigned, but she continued to help with the department as a visiting consultant till 1959 when they left India. And she continued to raise funds for the department even after. Between 1953 and 1954, young Dr. A.F. Desmond ran the department under the headship of Dr. John S. Carman, the surgeon. In 1954, A.J. Pat joined the department. It is said that he found it difficult, the change in culture was difficult to cope with. However, he stayed here for 12 years. It was during his period that the institution was recognized for MBBS teaching and the DLO and MS courses were started. I'm told he was a very good doctor, a good microsurgeon who had trained under Jack Ho and made it possible for Dr. Desmond to go there and get trained too. Dr. Banu tells me he was a strict disciplinarian, yet a very caring person. He maintained meticulous records and would keep checking the postgraduates' patient documentation and how they treated managed cases. He also was instrumental in building the ENT ward, I ward. He obtained funds, which he raised from the Adventist Church in America. And again, he was instrumental in buying our first microscope, both in 1964. He is said to have built the SDA house on the college campus and played an important role in the SDA church being built at Toteri. Again, this is interesting. Dr. Banu says he was an excellent surgeon and he always carried color pencils in his pocket and would often sketch the profiles of people. Very often, he'd sketched profiles of the patient on the case records. After him, Dr. A.F. Desmond, who was born to missionary parents in Missouri, took over the department in 1966. Dr. Desmond had worked here from 1951 after training in Stanley Medical College. He was the first to have done a stapedectomy in India. Dr. Desmond was a much loved doctor in the small town of Vellore. As a child, I've heard and seen him. He lived and died in Vellore. His passion for photography was well known. He has documented many of the institution's important events through his photography. Now he's known for the swimming pool. Dr. Banu, a CMC UG and PG alumnus, joined the department faculty in 1970 and continued till his retirement in 1989. He again was a much loved doctor in the small town and a very popular person. He's known for his legendary angiofibroma surgeries. I'm told that he would finger dissect large tumors and pop it out in record time with minimal blood loss, and recurrence was unheard of. Dr. Banu has also pioneered research on dapsone therapy in rhinosporidiosis and published papers on it. He's been a member of many societies and has had many accolades and awards to his name. He conducted the only South Zone conference at CMC in 1983. He continued to work with the CMAI and the Tribhuvan University in Nepal. And now he lives with his children in Padar. Next came Dr. Raman, a CMC alumnus too. He was a good clinician, an excellent and versatile surgeon. He started the initial laryngotracheal surgeries and reconstruction in 1991. He had devised an alkathene shell to keep the patient's head flexed. Dr. Raman's passion, he loved to do stapedectomies under LA and often did a series of them in a row. It was during his period that the Bengali patient influx began. And he was instrumental in getting us the new OPD, the current OPD on the 3rd floor, which happened in June 93. He is known for his good humor, and he was a very strict boss, yet a very compassionate one. He tore you to bits if he found your work lacking. That was Dr. Raman. Dr. Anand Job, a campus kid, took over the department in 93 and continued to head it till 2001, when it was divided into 2 units. He continued to head the unit 1 till his retirement. This quiet, unassuming person had a surprising, wicked sense of humor, and all of us have been a butt of his jokes at some time. He was a daring surgeon, as well as he gave us a lot of opportunity to grow. Laser was his passion. He used to do a lot of good cancer surgery, especially for patients who refused to have the debilitating laryngectomy done. Saying all this, outreach work, community work, and mission work was what was always close to his heart and continues to be. He serves many mission hospitals now. And next, we had 3 pretty maids in a row. The beautiful and vivacious Dr. Mary Kurian took over headship in 2001 when the unit divided, and she continued to head the unit 2 till her retirement. It was Dr. Mary who started the diagnostic endoscopy in CMC in 92 and endoscopic sinus surgery in 1993. Her real passion was the pediatric ENT. Her organizational skills were excellent, and her motivational skills were par excellence. She, after retirement, she headed the department in PIMS. Another beautiful lady, Dr. Rupa, quiet, and soft-spoken, took over the department in 2005 after her study leave and the unit, and continued to head the unit till June 2019. She was an excellent academician, a good surgeon. She had organizational skills and record keeping, which all of us ought to have imbibed, but sadly haven't. She's done a lot of fundamental research. Her pet projects were on fungal sinusitis. Though her initial passion was oncology, otology, she moved on to rhinology to serve the department's needs. Dr. Rupa started endoscopic skull-base surgery along with the neurosurgery team in early 2000s. Dr. Achama Balraj. She was also a UG and PG alumnus. She worked in the department for a few years, did a stint in UK, and then came back. Her passion being hearing and vertigo. She went and did MSc in audiology in UCL London. Dr. Achama ventured into no man's land, the peripheral vertigo, and started a clinic in 2002. And then an audiovestibular unit clinic in 2005, and ultimately a audiovestibular unit in 8. She spearheaded divisions, and she headed the unit 4 till her retirement in 2015. Many of you may not realize Dr. Achama was a university tennis champion. Dashing Sov John Mathews came next. He was also a CMC alumnus, and he had the unique honor of heading 3 different units at different times, and subsequently the department. He was known for his meticulous surgery and also for his kindness. John did the first cochlear implant in CMC along with Dr. John Graham in the year 2004, when Dr. Mary had organized a pediatric ENT conference. And subsequently in 2005, John started doing cochlear implants here. John has also done the first implant, bilateral implant for the youngest child in all of India. This was done on a 22-month-old in the year 2005. Sorry, I'm not sure of the year. Our loss was certainly Muscat's gain. Next, I took over the department from John and handed it to Dr. Ajoy Matthew Verghese. The brilliant Dr. Ajoy Matthew Verghese was the brain behind the new ENTOR complex. And we would like to think of him as our own COVID hero. He ably managed the COVID swabbing. Many of you would have forgotten this. That was again a no man's territory. Nobody wanted to swab. He alleviated the fear. He devised the swabbing technique. And along with Dr. Suma, they did initially only the ENT department was swabbing for COVID. They started training paramedicals and nurses also to do the same. Not only this, he ably managed the department with less staff, people falling ill and people on COVID duties, and also did all the COVID duty scheduling, which was mind-boggling. And now we have the calm, competent Dr. Suma, and I'm sure she will take us far ahead. We have had many firsts in the department. Like I said earlier, here are a few. Anjali did the first implant in a very young child, a 5-month-old. I shall only briefly touch on the clinical milestones. Like I said earlier, in 1964, the first epidectomy was done in India, as well as the eye ward was opened. In 1966, we had a hearing and speech clinic that was started. In 1991, Dr. Rupa started doing BAR in the neurology lab. And in 1994, we bought our own machine, and she continued to do this in the department. In 1994, we got a biopsy channel, a flexible endoscope with a biopsy channel. So we were able to do biopsies without taking patients under GA, laryngeal biopsies without taking them under GA. 1998 was a good year for us. A dedicated diagnostic endoscopy room was started, where endoscopies were done all day. These microscopes were obtained, so more operating opportunities, and also craniofacial resection was done along with neurosurgery. There are many other things that have happened. I'm not going through it. And it is worth mentioning that Dr. Achama started the hospital-based universal neonatal screening in newborns in 2010. The audiology services were started by Dr. Kapoor, who you see here, in 1962. He had many research grants and projects. He contributed in a large way for the Speech and Hearing Association. And here's a ear mold lab in the early 60s, I think. And this is the current audiology staff. All of them are not here. The audiovestibular services, like I said, Dr. Achama started a clinic for peripheral vertigo in 2002. And then she started an audiovestibular clinic in 2005, where she would see giddiness and people with hearing loss without ear discharge, as well as do auditory therapy for cochlear implantees. Subsequently, in 2008, they started a unit for the same. I shall not go all these tests and other things that we have. Like I said again, that in ENT functioned as an independent department since 1946 and continued to do as a single unit till 2001. And due to the workload, divided into two, and when Dr. Mary headed the department and the unit. And I've gone over these, and as Suma has mentioned, we divided into 5 units in 2014. This is at the inauguration, each with a special interest and doing general work as well. The head and neck surgery department was thought of from the late 70s, but finally happened in 2016. Dr. Rajiv moved on out of ENT to start this department, along with Dr. Rajnikant from Surgery 1. As a department, we are deeply committed to nurture the future generation of medical professional. And here you see a young Dr. Jacob passionately teaching the batch of 1979. Some of you may recognize Indrani Sen and Ashish Shrestha. 1999. Batch of 1999. The postgraduates in 1960, in the mid-60s. Here you see Dr. Desmond, Dr. Devloy. This is Dr. Banu, and that is Dr. Alpheus Joseph, our first MS postgraduates. And this is Dr. Peters, who did ENT, DLO. He is the father of Ellen Peters. Some of you may remember her. Some of our postgraduates have done us proud by winning gold medals at the university, state, and all India levels. The first postdoctoral fellowship was started by Dr. Mary in 2012, and now we have 6 currently in the department. A bachelor's course in audiology, speech and language pathology was started in 2013. In the 80s, interestingly, in the 18s, a CMAI course was thought of, but it didn't materialize. In 1997 to 98, we had a course run in the department, which fizzled out. In 2006, Dr. Achama started a diploma in speech and language, which was recognized by the RCI in 2012 and continued to 2007 and continued till 2012 when it was removed from the RCI. A bachelor's course, as I said, was started in 2013 with an intake of 10 students and Dr. Swapna as the head. And these are the teaching staff. This was at a recent graduation. And these are our current students. From the early days, the department has been conducting CMEs for regular CMEs for general practitioners in the town and around. CMEs for and workshops for postgraduates was started first in 2001, and subsequently we have many going on now. This is at the first FEST workshop. We had faculty from all over South India, including Dr. Hasarika, and these are our alumni doing cadaveric dissection. The first temporal bone hands-on workshop was in August 2002. As it is a mandate, we have a skills lab in B ward, and we have dedicated it to our late colleague, Dr. George Annie Memorial. We are working on expanding the skills lab. There's always a lot of fundamental research that has been done in the department. It is said that research was done on monkey larynx in the 90s. We've had many grants and projects, national and international, and we continue to do so. Innumerable publications from the department, which has received accolades all over. We have an oration which was instituted in memory of Dr. Rita's sister. These were the first few orations. The first was done by Dr. Ramalingam on obstructive sleep apnea in 1993. This was the department in the 50s. I can only recognize Dr. Desmond and his wife, and Dr. Pat and probably his wife. And this was the department in the mid-80s. You see Dr. Banu here, that was Carrie Lamb, who was a speech pathologist from England. Sister Mariamma, who was our eye ward sister, and the other alumni. These were our teachers, Dr. Suresh Babu, Dr. John, Dr. Gunasekran, I think that's Dr. Raman, and Dr. Anand. And that's Dr. Rupa too. This is the department in the mid-90s when we moved to the new OPD at the much cherished and loved late Mr. Sautaya, our hospital attendants, farewell. Mr. Sautaya was to help the PGs with tracheostomy. He would assist our early PGs. This is the department in recent years we have grown. Our OPD, it's interesting. We were on the first floor of the OPD building till 1993. When we moved up, this was taken shortly after we had moved up. This is the private waiting area. Our statistics then was around 27,000. In 2013, we had 5 cubicles added, and our statistics is around 87,000. And now when our statistics is over 120,000, we still have the same space to work in. I found this interesting. Annual report from Dr. Devolai, the ENT surgeons, surgeries done were quite similar to ours, only that we have no fancy equipment and powered tools. We thank the institution for the new ENTOR complex, a state-of-the-art one, which was inaugurated on November 30, 2013. And we do enjoy working here. Our operating rooms were initially 3 and 3A, which were like little dungeons. We had 2 tables twice a week during from the 80s to the late 90s. And in 2000, we got OR 13 and 14, which was a little larger dungeon. And then we've moved to the spacious ORs with 4 tables 5 times a week. Here you see ear surgery being done by Dr. Jack Ho with a microscope with no eyepiece. Now we have microscopes which are very fancy and cameras that can split images into 3 screens, which helps us teach medical students, our PGs, as well as guide the juniors during surgery. In 2001, we had got the carbon dioxide laser, and now we have the luminous laser, and we do a lot of laser surgery too. Outreach has again been a passion in ENT. Peripheral camps in villages were done along with Rotary, Lions Club. It's interesting. And even with SBI. In the 80s and early 70s, they went along with CHAD and the urban units to peripheral villages. In the 90s, we went to Earth Trust and Thirumalai Chemicals, among other places, every month. Again, we started doing surgical operating camps at Madanapalli, Mandiram, Kottayam, which has now extended to other mission hospitals all over India. I must tell you this, but we went to do camps at Madanapalli. It was a week-long surgical camp. We would go as 2 teams. Either Dr. Mary or Dr. Anand was team 1, who would go on Monday, see outpatients and start operating and do so till Wednesday evening and return. And team 2 would go on Thursday morning, work till Saturday evening, close shop, discharge the patients on Sunday morning and return by Sunday afternoon. It was very enjoyable as well as a good learning experience for all of us who had only trained inside a well-equipped hospital. This was the South Zone conference that was held here in 1983. There you see Dr. Raman, that's Dr. Alex. I don't recognize the others. And this is senior Dr. Kameshwaran, who's no more. Our social gatherings, our Christmas dinners are something we always the whole department looks forward to. In the early 90s, when we did not have a space, the department dinner, Christmas dinner was held in the male medical students' resting room in the basement. And sometimes at homes. Then we moved on to YWCA. And now we use the Paul Brand quadrangle. Here you see this pretty, beautiful, bright-eyed little baby is now a final year medical student here. There were other dinners too. Our retreats were well attended. We had picnics, trekking. As part of team building, we have picnics, trekking, and even games. In this cricket match, intra-departmental cricket match, you see a lot of us. I wonder who the person of the match was. Was it this athletic head, the glamorous head, the fast bowler, the spinner, or the head behind the mask? Your guess is as good as mine. I'll keep you guessing. Our reunions are well attended too. It is a time we celebrate and get together and recollect old stories. We plan a reunion on the 14th and 15th of February in the coming year. I would like to use Aunt Ida's words and say we thank God for the way in which he has led us in the past, and we look forward to an even greater future. Thank you.
Good morning, friends. I stand here to represent Unit 1 of Department of ENT. ENT Unit 1, the mothership of all units, continue to explore new and uncharted frontiers. In 2014, when we divided into 5 units, doing general ENT and our own special interests, ENT1 took up head and neck and skull-based surgery. Now, the unit then was headed by Dr. Anand Job. As we all know, he is an astute clinician, a very versatile surgeon, but also a compassionate human being. He pioneered many of our ENT complex surgeries that we do. He was interested in head neck oncology, transfemoral laser surgery, tracheal reconstruction, skull-based surgery, community ENT, and mission outreach was his passion, as Dr. Ruby was saying. Dr. Rajiv Michael took over from him in the year 2015 and led the unit till 2016. And he continued to build head neck malignancy services and did some advanced laser and head neck malignancy work. As the institution demanded, he, along with the General Surgery Unit 1, formed the Department of Head Neck Surgery, and he continues to be head of HNS 1 there. In 2016, Dr. Reggie Thomas took over as the head of the unit with specialties in expanded endoscopic skull-based surgery, and also introduced some fish approaches for the lateral skull base with this training from UPMC Pittsburgh and the FIM Center in Zurich. The current faculty in the Unit 1 is headed by Dr. Reggie Thomas, and we have 5 more faculties in the unit. And we continue to do undergraduate, postgraduate training. We also have a specialized fellowship where we train postdoctoral fellowship in head and neck surgery and skull-based surgery. So we have our fellows in various institutions in the country, and we currently have Divya and Reshma with us. We not only did run a fellowship here, but we also run a yearly course for all the ENT surgeons in the country who are interested in skull-based surgery. We run an anterior skull-based surgery and also a lateral skull-based in similar fashion as we learned from UPMC and from Zurich and Adelaide. Our services continue to do general ENT, head and neck, and also the skull-based surgery, both in the town campus and in Ranipet campus, where we run skull-based surgery clinic and also an integrated clinic along with neurosurgery on Mondays and Wednesdays. And our OP statistics have been picking up to the old levels where before we divided into 5 units. And so does our surgical and also other diagnostic work that we do has picked up significantly after we've joined hands with neurosurgeons. Interesting to note that we have done more than 500 skull-based surgeries in the Ranipet OR since its beginning from September 2021. So we offer a series or wide range of surgical approaches, both in the sagittal plane and also in the coronal plane. And this is just one example where we have exposed right from the cellar down to the odontoid process, and all pathologies in this axis, in this route, we address them. As Dr. Ruby mentioned, Dr. Anand is passionate about community outreach and also mission outreach. So we have our Anand Community ENT Care that we have instituted, and part of which we have upgraded the clinic in Chad, where we have modern facilities for both OP and also to go outreach and screen patients in the periphery. We go out on various mission camps around the country, and we follow the trend and the legacy that Dr. Anand has started. This is just a list of places that we have visited over the last 10 years. And the places that we have highlighted are the places where we have actually instituted a full clinic, and we also have diagnostic facilities. And we not only do simple surgeries, but major surgeries have been done there. One of the pictures you can see where a student who went as an undergraduate now goes as a consultant to one of these clinics. And we also take our postgraduates to do surgeries there. Research and training is also a passionate arm of ENT1. This is the graph to show that we have increasingly started publishing in both national and international journals. And here are a list of a few important articles or papers that we have published both in international and national journals. We gain more and more expertise by collaborating with centers abroad and around the world, especially premier centers in skull-based surgery like UPMC in Pittsburgh and the FIM Center in Switzerland, Zurich. And we also had opportunity to go and do doctoral work in Adelaide and also go and train ourselves in Pittsburgh. This is Dr. Reggie signing an MOU with the team in UPMC. So all this has really increased our work, and now we also translate our work into training others. We also had a grant from the Australian government to set up an endoscopic skull-based surgery training lab. The work that we do is not just work, but it is people that we are building. And over the years, many have contributed to the work in the unit. And here we have people from various parts of the country who are now being trained and mentored by us. And we thank God for all that he has given us. We walk in his ways and wait for him. And that is a desire and passion of our hearts. Thank you.
Okay. So very good morning to everyone. Reiterating the vision of CMC Vellore, I would like to share our story of pediatric ENT services, which contributes a significant portion of our regular work. So our genesis, children are not young adults. With that aim, Pediatric ENT Fellowship was started in 2012, the first fellowship to start in the department when Dr. John Mathews was heading the unit. Dr. Mary Kurian was instrumental in starting the fellowship, which was the first of its kind in the country. Dr. Mary and Dr. John were our mentors for the specialized pediatric ENT work. Here you can see that the first picture where this is one of the first pictures after division into pediatric ENT. And this is a recent picture. This is the stickers we give to our children when they come to the OPD. And these are some of the recent pictures of the team. With regard to education and training, since 2012, we have trained 1 or 2 fellows every year, and 2 of them are our current faculty. Fellows from other related specialties also come for postings with us. We regularly conduct pediatric ENT conferences, CME, and hands-on workshops with eminent national and international faculty. The simulated scenarios of pediatric emergencies, rigid and flexible bronchoscopy in mannequins, airway surgeries practiced in sheep larynx, the cochlear implant insertion in models were well appreciated. We also contribute in various national and international conferences and workshops as invited faculty. You can see some of the workshops which are there. And down we have Dr. Cheng, Dr. Cheng from Sydney, and Professor Stephen, who is the head of ENT from Melbourne, sharing two stories. This child presented with stridor, had bilateral abductor palsy. So you can see the picture of what the endoscopic picture. It shows that there is abductor palsy, and airway was created by putting a cartilage in the position. And after that, the child is sleeping well, And later you see that the child is also dancing happily. Uh, multiple surgeries and ICU admissions, but in the end the result was good. Another story is about a child a child who presented, two siblings who presented with bilateral profound hearing loss with abnormal cochlea. They received the gift of hearing through the generous donation of cochlear implants by Graham Clark Foundation. The surgery, the switch on, and every stage was a challenge. But in the end, it was satisfying to see both of them doing well. And we also see the sparkling eyes of some of our implanted children. This is just the brothers trying to teach
One, two,
Along with just adding on, there is the child which underwent the first simultaneous bilateral implant by Dr. John. She is doing well and she has gone to VIT to start her professional course. And with regard to the peripheral ENT services, we provide regular ENT services including OP, minor procedures and selected surgeries, and audiological services including neonatal hearing screening and AVT at LCSU and Shalom, thus supporting the local, less privileged people around Vellore. One of the paper published in ENT specialist on ENT specialist at periphery underscores the importance of this. Through the family medicine department, we are also involved in community ENT projects such as hearing evaluation and rehabilitation HEAR project. We also acknowledge the generous contribution from the Friends of Vellore UK and also the enthusiastic support from the Scudder School children for this endeavor. Our faculty also provide regular ENT services to mission hospitals such as Dimapur, Ayodhya, and also the hospital in Kotagiri. With regard to research, CMC was part of the first multi-centric clinical trial for the Indian-made cochlear implants Ravan. The results were promising, the proof of concept. The next advanced version, if successful, can contribute significantly to the hearing impaired community. A good number of undergoing research explore in the department or in the unit, explore the common pediatric ENT problems such as the upper airway problem of the microbiota and the interactions, obstructive sleep apnea, and drooling in children, etc. The study molecule, Streptococcus salivarius of my PhD, was procured from New Zealand and is grown and kept in the Department of Microbiology for further studies. We do have our share of fun and celebration, be it treats or retreats with family and friends. And today afternoon also we are heading on for our unit retreat. All the current confirmed faculty, Doctors Ajoy, Naina, and Kamrin and myself, got the opportunity to get trained or experience the state-of-the-art standalone pediatric hospitals in the world, like Westmead Children's Hospital in Sydney and Royal Children's Hospital in Melbourne. A facility like this and an MCH in pediatric ENT, again, it will be first in the country if it happens, can push the pediatric ENT services and training to a higher notch. That's our dream. As part of building the kingdom of God, we as a team strive to be good stewards of the talents, opportunities, and the time given to us to bring glory to his name. Thank you.
Good morning. I'll be representing ENT Unit 3. So this unit was formed in 2005 under the headship of Dr. Rupa. And in 2014, we specialized into rhinology and anterior skull base. And she was the pioneer in skull base surgeries in CMC. And so this is us now with Professor Reggie Kurian heading the unit, and we have another 4 consultants in the unit. Apart from the normal ear, nose, throat cases, we also see inflammatory conditions like sinusitis, with polyps, without polyps, allergic fungal sinusitis, and so on. We also see trauma cases and CSF leaks. We see a lot of benign and malignant lesions of the anterior and anterolateral skull base. And a large number of fungal sinusitis is also treated by us. And in fact, during the COVID-19, we operated more than 250 cases as a department. We do see a lot of granulomatous nasal conditions as well. We offer surgeries for external nasal deformities and also obstructive sleep apnea. We provide emergency services in the main and Ranipet campuses, with unit-specific emergencies being invasive fungal sinusitis and other complicated sinonasal lesions. We have a few procedures. We do endoscopies around 200 per week. We have olfaction clinic and allergy clinic where we counsel the patients as well. We have a 2-year university accredited postdoctoral fellowships, and these were our previous fellows and the current fellows included. And we do have teaching sessions with MDT, pathology, and cadaveric dissections for the students. We have a number of CMEs and workshops to our credit, and the last one we conducted recently in 2024. There's been a number of publications from the various members of the unit, and we have around 60 publications in the last 5 years. Our outreach is mostly to the Ruza Hospital, where apart from providing our general services, we have also trained rural health assistants from other states in basic ENT conditions. We do a lot of surgeries, all the common ENT surgeries of pediatric otology and laryngology, and we do a whole lot of spectrum of endoscopic sinus surgery, including functional and expanded sinus surgeries, skull-based surgeries for benign and malignant lesions, and CSF leaks, and many more. We have external approaches to the frontoethmoidal lesions. Maxillectomies form a large number of our series, and we also do craniofacial resections along with the neurosurgeons. And our other specialized surgeries include surgeries for obstructive sleep apnea and rhinoplasty. And this is the most of us. Thank you.
Good morning. On behalf of ENT Unit 4, it is my honor to present our reflections over the past decade. From its origin as an audiovestibular clinic started by Dr. Achama, the audiovestibular specialty grew initially into a partial unit with 3 consultants and a senior resident. And in 2014, when the specialization in the ENT department happened, this specialty became incorporated into ENT Unit 4, which deals with otology and neurotology. We are now a team of 6 consultants, an SR, 4 fellows, and PGs on rotation. At this point, I would like to acknowledge Dr. Achama Balraj, Dr. John Mathews, and Dr. Anjali Lepcha, who have led us over the past years. Dr. Achama, as has already been mentioned, spearheaded the audiovestibular specialty in the unit. Dr. John took forward the otology and the cochlear implants. And Dr. Anjali Lepcha, during her term, took both these specialties forward as well. We are eternally grateful for the leadership that they have provided over the years. And it is their passion, their hard work, and their mentorship that has brought us to where we are today. The clinical services that we provide, apart from general ENT, include 3 specialized clinics. The audiovestibular clinic, which deals primarily with dizziness and balance problems, and the ear and hearing clinic, which deals with otological problems, and cochlear implant clinic, which deals with patients who have significant hearing loss, either needing or having already had a cochlear implant. Apart from this, we also run the institutional occupational health services, wherein we identify, screen, and follow up staff who are at risk of noise-induced hearing loss. We also oversee the universal neonatal hearing screening program in the hospital. The audiovestibular specialty has developed over the years alongside the otology work, and we now have most of the technology that we need for evaluation of vestibular pathologies. We also have a well-established vestibular rehabilitation service, which Mr. Lenny from physiotherapy was instrumental in setting up after training in the field. We do a wide range of specialized surgery, which includes the entire spectrum of otological work, endoscopic and laser ear surgery, lateral skull-based procedures, cochlear implants, bone-anchored hearing aids, facial nerve surgery, and specialized surgery for vertigo. The Universal Neonatal Hearing Screening Program was initiated by Dr. Achama as an ICMR project, but this is now a full-fledged service, screening about 12 to 14,000 neonates every year. And we also follow up and rehabilitate those who are identified with hearing loss appropriately with hearing aids or implants. The Universal Neonatal Hearing Screening Program was also awarded the Scotch Order of Merit in 2016. And as already mentioned, Dr. Anjali Lepcha has the credit of having done a cochlear implant on the youngest child in the nation at 5 months of age. This child was developed hearing loss because of meningitis. Our research areas are mentioned here, which includes, apart from otology, auditory neuropathy, central and peripheral vertigo, electrophysiological tests of hearing and balance, cochlear implants, tinnitus, autoimmune inner ear diseases, and neonatal hearing screening. And we've had multiple publications from these as well. Going on to education, apart from the regular postgraduate and undergraduate teaching, we're in, and for teaching for our BASLP students, we have fellowship programs. All of us in the, most of us in the department, in the unit, have made use of institutional opportunities to train ourselves further in the specialty. We currently run 2 fellowship programs, the Audiovestibular Fellowship, which was the first of its kind in the nation, and the Implant Otology Fellowship, and both of these are university recognized. I have put up here pictures of all the fellows who have gone through us over the last 10 years, and they're all doing very well in different parts of the country and overseas. We've done multiple CMEs and workshops, including hands-on audiovestibular workshops, and the recent temple bone workshops for PGs, we hope would be a forerunner for similar workshops in the future. We also have conducted multiple public health initiatives, especially with relation to World Hearing Day, and we try and promote ear and hearing health in this way. Apart from this, our consultants in the unit have helped out in mission hospitals in Kerala, Chhatarpur, and Nagpur. In conclusion, in ENT Unit 4, being inspired by our collective heritage, we hope that we will likewise leave behind a marvelous heritage for the generations to come. Thank you.
Good morning. Sorry, there is one more presentation. So I am representing ENT 5, just a short run through of where we were when we started in 2014 to where we are now. We know that we cannot mention ENT 5 without talking about our office. So this was for the last 10 years. You can see in the picture about how we are 3 things in the same place: the audiology library, ENT library, and our office. And the picture is not part of the office, that is our entire office. So we were there for the last 10 years. And in 2024, a decade later, we finally got a modern, swanky new office, according to the rest of the people in the department. And we are quite grateful that we got this. We cannot mention the present or the future without the past. These are a few of our faculty who used to work with us. Dr. Ram and Dr. George were there when we started the laryngology unit. Dr. Philip joined after that, and Dr. Meet after Dr. Philip left. The current faculty is shown in the pictures here. We have 3 professors, 1 associate, and 2 assistant. We continue the legacy started by our seniors. We run 3 clinics on Tuesdays and Fridays: the general clinic, airway swallowing, and the voice clinic. There's various services we offer. What we've started was the office-based procedures. We do injection laryngoplasties for glottic insufficiency, EMG guided Botox injections along with the neuro department for spasmodic dysphonia, and flexible channel scope assisted laryngeal biopsies are done under LA in our outpatient clinic. Our unit also provides voice and airway procedures. So these procedures are what is done for vocal cord mobility where the voice is not strong enough, and the airway procedures are for stenosis and which block the airway. There's a short clip of a girl, we've taken her consent, who was actually speaking after 1 year of her injury, where she's voiced for the first time. You can see the happiness with which she's speaking. And if you listen closely, listen to the name of the person.
नाम रीना कुमारी पासवान है, हम वेस्ट बंगाल से आए हैं।
So it's Reena Kumari.
मेरा गला का प्रॉब्लम है, गला भारी टाइप का हो गया है।
This is
मेरा नाम रीना कुमारी पासवान है, हम वेस्ट बंगाल से आए
She
हैं।
had a masculine voice.
वॉइस थेरेपी के लिए
And
आए
after
हैं।
the procedure called Wendler's glottoplasty, we managed to give her the voice that she wanted.
नाम रीना कुमारी पासवान।
We do oncological procedures as well. Narrowband imaging is a diagnostic one, and along with it, we do transoral laser microsurgery and laryngectomies for advanced laryngeal lesions. Swallowing is an integral part of our department. Evaluation by endoscopic evaluation called FEES, and along with the radiology department, we've started the video fluoroscopic swallow study. Procedure-wise, cricopharyngeal dysfunction is treated with Botox and dilations and esophageal dilation as well. We provide 24/7 cover for neck trauma, both in Ranipet and main campus. This is one of our patients. Like all the other units mentioned, we provide mission service as well. And these are the various places that we go to and the pictures from the various places that we've been. Georgiani was one of the people who were really passionate about it, and we all hope to continue the same. Community activities, we provide health education for the care of voice. We've given it to teachers from our local schools and the MRD staff in our hospital. Tracheostomy care modules have started in full swing for the nursing staff, and we've started a couple for the doctors, and we continue to do more of the same. These are the various publications, and we hope to keep continuing the research part of our vision of CMC. Our fellowship course started in 2016, and the alumni are, we've finished training 5, and the current fellows are Dr. Gnanavel and Saranya, who's currently in the department. We cannot do our work without the help of our speech and language team, led by Mr. Tejesh, Mr. Jasper, Angel, and Annie help. And of course, the unit cannot run, and currently the department cannot run without Mrs. Indumati. These two are the heads. I think ours is the only unit where the heads are still in the department. Everybody seems to have past faculty. So the incredible duo who found the vision for our unit when we started as a brand new unit, when none of us knew what we were supposed to do, and they continue to guide us forward. Small mention about 3 people. Dr. Paul Castellanos took a keen interest in our hospital once Dr. Suma went for an observership there, and he continues to guide us through workshops along with doubts that we keep clearing. Dr. Piku helps us with the laryngeal vocal cord surgeries, and Dr. Munia is a pioneer in our laryngotracheal surgeries. These are a few pictures where we enjoy us as a unit for parties and all. Last but not the least, we cannot forget Dr. Georgiani, and we have to say that he will forever be in our memories. Thank you.
The department is grateful to the administration for all the support we have received, and we would like to acknowledge the untiring efforts of all the staff, the nursing staff and the OPD, the wards, the OR, the MRD, the audiovestibular lab, our office secretaries, and all the support staff and our chaplaincy, as well as the sister departments who help us in our work. I would like to echo the words of Bernardine de Vellore. We have been conscious of God's presence in guiding and directing our course, as well as conscious of his healing hands on the many patients who have come to us. And we look forward to an ever increasing sense of his nearness as we continue to serve him in the coming years. And in conclusion, I'd like to say we entrust our future into our Lord's hands. Thank you.